This is our live session, and I'll be having a presentation to a group of young pharmacy students on a research method. And thank you for joining. So we'll be starting the session right live now. I'll be using a PowerPoint to teach this concept, but I believe I am audible enough, and I'll invite you to be to like and share my content. Good. Hello everyone. Recording in progress. Hope I'm in now. Yeah, that is so interesting. Hope you can see me. Yeah. Am I audible, Suzanne?
Yes, sir.
Okay. Great. So, sorry for the delay because it was a different link, and it's great to be with you this afternoon to share basic concepts when it comes to research methodology. So, let me know when I should start. That is, who is the chairman? That's Susan.
Thank you, sir. Thank you for joining. Actually, we have an issue with the link, so we changed the link and we are waiting more for participants to join.
Okay, no problem.
Just give them some minutes.
Okay.
Next time, I'm the moderator today. Also, Susanna is here, and maybe in 5 minutes we start.
Okay, that is okay. I'll wait for others to join, then we can start. Okay, thank you. You let me know when we're ready. Yeah.
Thank you, sir.
Hello, colleagues. Following this one on TikTok
Hi,
and also on YouTube. Today, I'm having this live session from my office, and I'll be talking on research methods to a group of young university students from across the globe. Later on, we'll see from where they are joining. That is an international Pharmacy Students Federation, IPSF. Today, I'll be talking on research methods, on the different types of research methods, on study design, research ethics, and not only that, about systematic review, meta-analysis, and a bit of citation. So, those following live, maybe later on at the end of the session, I'll be sharing the link to my PowerPoint on YouTube. Please make sure you go to YouTube and subscribe my YouTube channel at Dr. Ermias MT. This is the same username you'll find in all social media. So stay tuned as we start the live session. Suzanne, did I miss something you said? I was doing something parallel.
And I wanted to do a week one recap as we wait for the participants to join.
It's okay, fine, okay.
Yes, I'm seeing 22 people have joined. So on your screen, you can see the welcome to week 2. So move to the next slide and you see the question, and then you respond, and it will appear on the screen. So the first question is, how are you feeling today? Okay, great.
Okay, colleagues following this live, you can tell me from where you are joining. If I'm audible, you can say hi. Let me know how your day is. Today, Saturday. Maybe you can say hi. Hi, Emias. Hi, Jeremiah. My name's Ermias Jeremiah, the same names. You can indicate maybe from where you are joining this live session. This is live both on TikTok and also Instagram and also on YouTube. You can also follow the same on YouTube. So today I'll be talking about the key thing, that is research. Remember, the big countries across the globe, they invest heavily on research, and I believe it is very important for us to support the young generation and also us to do a lot of research so that our continent, our country will develop. Hi, William. Thank you. William from Mombasa. How is the weather in Mombasa? Hope it's so hot now. Who else? Maybe you can tell me from where you are joining. I can see Jacqueline, Shadam. Thank you for joining. Thank you for the likes. Let's like, share, and also comment and engage. Let's really engage. That is the main benefit of having such platforms. Yes, and yeah, and as I usually say, if you need a one-to-one coach mentorship, feel free always to reach out. I'm having quite a number of series of meetings, sometimes in the evenings, with some people interested in innovation, research, those who need support in their academic journey. I'm having meetings with people who are interested to improve their body weight, wellness. Just reach out, we'll work on it together. And at the end of the day, you would really appreciate that effort. In this live session, as I said, today it's a talk on research method. Maybe on the chat, wherever you are, you can indicate if you have ever done a research. Have you done research before? How is your research journey? Maybe let me see in the comment section if you have ever done a research and how was the research experience. What is the challenge you faced when you did your research? Maybe it could be your undergrad research, your postgrad research, whatever. But let me know in the comment section on your experience in research, okay? Or do you need a support in your research journey? Do you need any kind of support? So today's talk basically focuses on research, on how best we can do research, on how we can really reframe our research question and the different study designs. You know, sometimes we think research is only for the scientists, but you know, if you are in marketing, every day you are doing a research, you know, you're checking the cost of items every day, and you know, research is a part of the human's life. So it's very important to know the best way to do research, the best way to engage, and it's an open space for everyone. So I'm here live. I have a session on my computer. I'm doing a Zoom with a group of quite a big number of crowd of people, students. I can see from Nigeria, from Rwanda, from Tanzania. Wow, that is a great team from Kenya. So we'll be talking on research methods, study designs. So maybe I may not be able to share the screen for today as I'm doing that. I hope by next time when I'm having presentation, I'll also be sharing my screen to my followers so that you can be able to see and pick one or two good things there. But for today, I'll not be sharing, but I'll try to make it as explanatory as possible so that even if you are not seeing the slides, as you listen to my voice, you'll be able to grasp the basic things. And for sure, you'll not regret at the end of this live session. For sure, you'll pick one or two things. So I'm waiting to see your feedback in the comment section as we wait the live session to start. The students are doing a bit of a recap. The moderator is warming up, but let me see. You can tell me from where you are joining. I can see Pauline, I can see Victoria, quite a number of people there. Earlier, William has told us he is joining from Mombasa, a very beautiful city. Let me see, who else? From Nairobi, who else from Kisumu? Yes, from Uganda, US, UK. Yeah, let me see. And from Ethiopia, let me see.
Primary, secondary, tertiary, journal articles, primary source.
So whenever you think about research, think about who is the big sponsor of big researches globally. And at some point, I remember one of our professor mentioning that globally 90% of research is funded by the US, and you can imagine big countries who are leading economy, even Africa, look, South Africa, Egypt. These are countries that invest heavily on research. Thank you, Victoria, from Nairobi. That is amazing. That is great. Others also, you can tell us. Also, if you're on YouTube, you can also tell me from where you're joining. That is so interesting. Yeah. To your colleagues, I was just sharing on Facebook. Yeah, great. I can see Stacy and others. Yeah, I may not be able to mention all the names, but thank you for joining. Let's actively engage. This afternoon, we'll be talking on research method. That is the main discussion point for today, where we'll talk on systematic analysis. I don't know if you have ever heard about systematic analysis, meta-analysis. We'll talk about cross-sectional study designs. How can you do a cross-sectional study design, a case study, a cohort study? And don't think that you are not a researcher, you are not an academia, and don't think as if this thing is irrelevant for you. Remember, research is for everyone. If you are in business, you know, the ideas of research, the tips of research are very, very fundamental, very fundamental. And today I'll be linking that one to hospital, to clinical areas. I'll try to link it to business, to economics. You know, research can be applied wherever you are practicing. So let's keep engaged, and maybe in the comment you can tell me if you are doing a research, if you have already done a research, whether you have published, or if you have really are having any form of a challenge in doing research. Let me know. Then this will be a good opportunity so that I can be of help, and I believe so. Good.
So I'm glad that you're here and ready to understand how you can be able to discover, to empower innovation, get solutions in the near future.
Yeah. Thank you for the likes. Thank you for the likes. Please, let's continue engaging. That is so great to see quite a number of you here. I believe I'm audible enough. If not, please let me know. Maybe one of you can kindly confirm if my voice is audible. Maybe you can put the like button so that I know that I'm talking to someone. Thank you, Oloch. Greetings. Great. Okay. Thank you. The likes mean that I'm audible. Wonderful.
The correct answer is books. Unpublished raw data is a primary source.
So yeah, thank you, Oloch. I'm audible, wonderful. And let me know if you are doing your research, or if before I start the session, or what do you think when you talk about research, when you talk about research method, what comes to your mind? What is the big thing you face that is difficult, or the difficult part of doing a research? You see, maybe you can let me know that in the comment section, so that when I talk, I'll try to connect that to your question. So my session is starting shortly. Let's wait, and then I'll be making very nice presentation. I have prepared quite very nice slides, and sorry, I planned initially to share even the screen, but some technology failed me. No worries. If you are listening, I will try to make it as explanatory as possible so that you feel you are in my classroom. So no worries. Yeah.
And you are welcome for our second week. And today our topic, we focus on the research method, systematic review, and referencing. So allow me to introduce our speaker, Dr. Emias Tefere. Dr. Emias Tefere is a consultant pharmacologist and an assistant professor of Pharmacology and Therapeutics at United States International University Africa. He is also the founder and lead consultant of IGRS Consultancy, where he delivers professional training and research consultancy, serves to health professionals and academic institutions. With over 20 years of experience in pharmacy practice, Dr. Tefere has worked across diverse settings, including hospital clinics as hospital clinic pharmacist, a production pharmacist in the pharmaceutical industry, and in education and training advisor for Johnson
Please share the
Hopkins
live to your
University
colleagues
project,
kindly
through which
so
he
that people
supported
can
capacity
join
building in
and
more
also get
than
benefit. I
10
think that is a
universities.
great thing to do.
He serves as an
Kindly share
expert
it
source person and advisor for
maybe
several initiatives under
to
the
your
Ministry of
WhatsApp
Health
group or whatever.
and the
But I think this
Pharmacy
is a good thing.
and Poison Board of Kenya. Dr. Tefere has published over 30 peer-reviewed articles, authored university-level books and professional handbook available on Amazon, and has supervised numerous master's and PhD students, guided by strong belief in simplicity, collaboration, and mentorship. He is deeply passionate about teaching and knowledge
Doing
transition.
introduction and
Currently,
introducing me,
actively
that is so
engaged in
great.
community service and capacity
Hope you are
building
listening.
projects, including training young researchers in computational pharmacology through his initiative MT CADA. And you can also find him on different social media, and he's called Dr. Emias MT. Kindly follow him. Like, you will not regret to follow him. You can follow him on the Instagram and on YouTube, on LinkedIn. You will learn more. And allow me to introduce you, sir. Dr. Elias, you are welcome. We are happy to have you today. The floor is yours. The participants are ready to hear from you. Thank you so much.
Thank you. Thank you, Esther, and also thank you, Suzanne, and everyone. Good afternoon, good afternoon. So let me see. It's just I can only see names on the wall. But before I start, I would really appreciate if I can see some of the faces who are joined here this evening, so that I know that I'm talking at least to few people. I can see a total of near to 50 people. Yes, Esther, that is amazing. It's great to see you there. Wonderful. And what about the others? I can see Simon, I can see Precious, Jean. That is great. And earlier I have seen the different country this team is composed of, all the way from Nigeria, Tanzania, Rwanda. I don't know if anyone from Ethiopia, but I've seen Kenya a lot. Anyone from Uganda? Maybe you can indicate from where you are joining. But thank you for the invitation. Yes, and thank you also, Esther, for that warm welcome and introduction. I really appreciate. Yeah. So this is me, and today I'll be taking you through, as the title indicates, that is on research method, systematic analysis, and systematic reviews, and also on citation or referencing. So basically this is a very broad topic, but I'll try to make it as simple, interactive, in a way that you can easily remember moving forward. So these are 3 titles. So I'll have 3 separate presentations. So the interesting part nowadays, I've managed to go to the social media, and I'm also, as I said, on TikTok and YouTube. As I talk to you live now, I'm also sharing some of the presentation ideas just live on YouTube and also on TikTok. So let me start my presentation. And basically, remember, when you talk about research, remember it is very fundamental when it comes to development. People usually think that research is basically for academic purpose, but research is beyond the purpose for academia. Okay, people say, yes, research is to get your degree, you do research for masters, for your PhD. But remember, research is all very important tool we have to improve marketing. If you are in business, okay, if you have a shop, if you are in pharmacy, in medicine, in marketing, research is a hat for development, because people in business also do marketing research to identify where the market dynamics is going on. Is that clear? So in my talk on research methodology, I will not make it also pure clinical. I'll try to make it so comprehensive, because as a pharmacy student learning in different universities in the continent, later on you might find yourself engaging in different types of research, or engaging in different type of workspace. So whatever I'm talking will be very fundamental. So basically, when we talk about research, the research method comes from the research question you have. Remember, so your research method is just like you are asking a question and you're looking for a way to answer it. Okay, you have a question. Maybe quite a number of peoples have gone to a certain hotel, and many of them have developed diarrheal disease, and you might be interested to know the cause of that diarrheal disease. Is it really linked to the food they eat, or is it linked to some other illness? You see, you have a research question. Or you might be interested to also to know a group of young people are abusing substances, maybe smoking weed or cigarette or some kind of substance abuse. Then also you might have a research question that asks what could be the reason? What is the push factor that is making these young people to go for substance abuse? This again another question. You see, so in a way to answer this question, you follow two modalities, two ways. In one side, you try to answer this question in terms of numbers, like how many people are affected by the spoiled food. Okay, what is the prevalence of malaria in Kisumu, in Mombasa? You see, these are all numbers. The other way, you are trying to answer a question in terms of what is the trigger. Is it a peer pressure? Is it mental illness? Is this psychological issue that's pushing young people to substance abuse? So if you try to compare the two questions, one tries to answer the question in terms of numbers, which is quantitative, asking what is the prevalence of HIV, let's say in the US. You see, this is just a question, and just you are asking prevalence, and the question is answered in terms of numbers. While the other question is, why are the young people engaged in substance abuse? What is the reason that makes people to miss hospital appointments? What is that factor that affects their adherence? They know they should finish their antibiotic, but when you see many people, they don't finish the whole dose of their antibiotic. So you see, if your question is only in number, that kind of research is quantitative. But if you try to understand their feeling, if you need to understand the why component, now that is purely a qualitative research. So yes, both types of research methods are very fundamental when it comes to health research in the health space. But in my talk today, I'll prefer to focus mainly on the quantitative part, and maybe I'll try to brief later on the qualitative part. Qualitative part, it tries to really narrate the story. So, and heavily qualitative research is used by sociologists, by people who do anthropologic studies and the like. But that does not mean it is not used in the health sector. For example, with my students, we've tried to assess the ethnopharmacological or ethnobotanical understanding of communities in the use of herbal medicines. Okay, one of my students has gone all the way to Machakos to the survey to assess what are the common herbal medicines used by peoples in Makueni, in Machakos, for their skin infections. You see, that is purely what type of research? A qualitative research, okay? But in quantitative research, you try to explain in terms of numbers. For example, when you do research in animals in the laboratory, basically you are trying to see which dose of the plant extract is giving a response. So you are talking in terms of numbers. Okay. Hope I've tried now to explain the difference between qualitative and quantitative. Let me give you 1 minute to digest what is the difference between qualitative and quantitative research. When do we use qualitative research? You see, we use qualitative research when our research question is when we are interested to have an in-depth understanding of our population, our sample. You see, but quantitative research, basically, the goal is not in-depth understanding. The goal is to work in a few sample and to make conclusion for the whole population. So basically, remember one thing of a principle of triangulation. Sometimes a research question, you may not be able to answer it either with quantitative nor with qualitative. Maybe sometimes you might need to blend both qualitative and quantitative research methods. At this point, let me know if I'm talking with someone. Maybe you can indicate. I don't know if this session has a like button. Nowadays, you can also show me your reaction if I'm talking to one of you, if we are together, if you are enjoying, if you are listening. Yes, let me know. Any question up to this point? Are we clear? And I'll be diving deep again further what the different study methods are. So these are not the two methods, you see. And remember, study, even the police, even people's insecurity, everyone uses research methods. Okay, how many mobiles are stolen per day? You know how many car accidents happen in a day. What type of research is that one? That is quantitative. It's telling me a number. But when the police or the traffic investigate, what is the cause of this traffic accident? Is it substance abuse? Is it mental illness? Is it lack of focus? Now that boils down to in-depth understanding of the problem, that is qualitative. So you see, research goes all the way. Good. Now, if we know the method, it's just like saying I'll use an Uber, I will use a plane to go from Nairobi to Dubai. That is not the research method. But further to dissect it, how can I better answer the question? Down the method, we have what we call study designs. For the next few minutes, I'll be talking about the study design. So research in quantitative research could be done either through observation or through experiment. Just you observe your population. You observe your sample. You observe your sample sometimes in terms of longitudinal. Either you observe for some time, maybe you can observe cigarette smokers like for 10 years. And if your research question is, really, does cigarette smoking really causes lung cancer? You know, you might have a question because you have seen quite a number of smokers and they are still alive, they are enjoying their life, and you may not be sure, or smoking ganja, smoking weed, mention it. There could be one research question you're having. So if you need to follow a group of people like for 5-6 years, you are not giving them anything, you are just observing them. That type of study design is what we call observational. Observational as is, or observational in a way to check the cause and the effect, the cigarette and the cancer. You see, spoiled food and maybe diarrheal disease, you know, obesity and diabetes. If you are interested to associate, still you are observing. However, if you come to the laboratory and if you try to administer a certain plant extract, a certain mitishamba to a lab animal, and if you need to observe whether that plant extract can cure malaria or not, now that type of study design will be interventional or experimental. So let's start from the first one. I believe now you are clear on what observational and experimental is. In observational study, we just observe. The same way I told you, what is the prevalence of migraine headache in Kigali, in Rwanda? You know how many people are really struggling with migraine headache. You're just going around and you distribute questionnaire, you interview people, you're just observing. You do your study in one day, you are still observing. But this study will help you to generate hypothesis. You see, it can help you to generate and also to test the hypothesis. Okay, maybe many people might be chewing miraa, maybe in some parts, for example, go for Meru, there is a heavy production of miraa. So you might have a research question saying, is there a correlation between chewing miraa and a certain kind of mental illness? You see, still this is what? A research question. So to answer this research question, you need a study design that is an observational study design. Okay, not experimental. I will come to experimental later on. So what are the observational study designs? For those of you writing, I'll give you a minute to write. I'm a teacher and I need students. I love students when they write. If you are listening me, please indicate or make a noise that we are listening. Can I get a noise? Are we together? Maybe you can indicate. You can indicate those emojis. Those are so nice things. I love them. Let me see. I'm counting. How many likes am I getting up to this point? And you are just listening. Yes. Good, good, good. Wonderful. Okay. If any question, I'll be openly checking the chat. Wonderful. Good. Thank you, Aisha. I can see you are listening. Wonderful. So, what are the observational study designs? One, we have descriptive and analytical. Let's start with descriptive. When we say descriptive study, as the name implies, you're trying to describe the whole population, maybe in terms of age. Maybe you're interested, I prefer, as you read, I prefer to explain it. You see, you're interested to assess the prevalence of malaria. Let me use malaria and Kisumu. So you are interested to assess prevalence of malaria in Kisumu. Okay, so you try to assess how many people have had a fever in the last 3 months. You see, maybe that is one typical symptom you're picking for fever. Among pregnant mothers, how many of them are admitted with high fever secondary to malaria? What are you doing? You're describing. Is malaria affecting men or women? Now still you are asking a question in terms of gender. Okay? So generally in descriptive study, what you are trying to do is to describe the whole population. And maybe you might be interested, then what is the benefit for me just describing the population? You see, sometimes such descriptions will generate a hypothesis. Imagine if majority of people chewing miraa in Meru are men, now you can try to correlate. Because majority of them who are chewing miraa are men, is there a correlation between chewing miraa and economy or development or employability, productivity? You see, one variable can correlate with the other one. Or if you say that malaria is heavily affecting women of childbearing age, then you can have a question saying, then in this area, majority of those people who are affected by malaria are the women and in childbearing age. You see, then you can now ask a question, is there a correlation of having malaria or Plasmodium falciparum, for example, and infertility? You see, now descriptive study can help to generate a hypothesis. It will not tell you that this causes that one. It will just tell you that, 20% of people in let's say where in Dubai smoke cigarette. Done. 40% of those who smoke cigarette are women. You see, and then it will tell you that of those who smoke cigarette and among the women, and like 90% of them are between age 20 to 25. You see, it's just describing. But by looking at different figures, you can connect and generate a hypothesis. So you see, descriptive study can open door for further research. Sometimes health managers really use findings of descriptive study for purpose of budgeting, for purpose of disease prevention. For example, one of the different types of study design you see in descriptive study are like case report. Example, you see, you work in a certain hospital and you find a guy with comes with symptoms of acute vomiting and diarrhea. Okay, persistent types of severe vomiting, severe diarrhea. which again present us with fever, and you suspect now this is a case of cholera. You see, just this one case, and that is what we call a case report. You see, so descriptive study helps us even to pick such kind of emergency things. For example, we have a number of cases. For example, the first report of, for example, rubella in pregnancy was found through what we call a case report, because 1941 there is this Australian ophthalmologist that is named Griggs, who reported a new syndrome of congenital cataract, which is linked to rubella in mothers during pregnancy. Just one single observation helped to detect, to find, to diagnose, and later on also for discovery of a vaccine. One report is very important. So what does that mean for those of you listening here today? You see, when you are a practicing pharmacist out there, sometimes you'll wonder, in patients, you'll observe a very unique side effect, a very unique clinical presentation, you see, and that should be reported as an adverse drug event. You see, that could be now, later on, it could be a case report. It could help also to identify side effect. Even as a pharmacist and as a researcher, you can compile that finding. You can describe the characteristic of the patient, and even you can publish that findings. That is what we call a case report, and that is one common modality by which we do research. Also, we have a case series. Sometimes not a single person, but you'll find quite a number of people may have symptoms of a certain illness. Maybe you work in a certain health center and you might find people presenting with severe neck stiffness and presenting with fever and yellow eyes. This could be a very peculiar thing. The patient has jaundice, neck stiffness, and also fever. Maybe this could be an indication of a certain kind of viral illness. This can also be reported as a case series, and it's also quite publishable. And we have a number of very successful case series stories that were published. Take, for example, the story of HIV. The discovery of HIV virus, the San Francisco story, is as a result of a case series where in San Francisco hospital, there was one patient who came with PCP, and the doctors wondered what happened. It's not a common case, and they treated with pentamidine. Another patient comes. It is when the third patient comes, now they stopped. They invited CDC and they did a whole-blown survey of that city. Then they found out that the disease is a very peculiar virus that reduces immunity, and the patient is presenting with a new type of opportunistic infection, which is not common. Then later on, they try to isolate that virus, and they called it the human immunodeficiency virus, a virus that really affects, that really draws down humans' immunity. You see, so case series is a very important type of study. Okay, so that was the history you see in HIV. The other one, it could also be a correlational descriptive study where you try to compare disease frequency with timing, with population. That is also a descriptive study. The most popular descriptive study, which is done by many students and researchers, is what we call a cross-sectional study design, where you try to study a section of the whole population. Maybe you are in a university, or maybe you are in a certain community, okay? Then you might study maybe 10%, 20% of that whole population. So here is where the point of sampling comes in very heavy. You do sampling, and then you study the whole research question. And the name implies cross-section. Sometimes, have you seen when you buy maybe pineapple, those people who sell will tell you, can you take a slice of this pineapple to taste whether it is tasty or not? Then you taste the pineapple, a bit of it, a cross-section of it. It's just like that. So you take a representative sample from the whole population, and you base your research on that small group of population. That is called a survey or a cross-section. So cross-sectional study is very good, especially it can tell you point prevalence, the one I told you, like the prevalence of HIV in Nairobi, the prevalence of malaria in a certain state. That is point, it's at that specific point, okay? Or it could even tell you over a period of time, maybe now in the month of January, how is the prevalence of maybe acute diarrheal disease. You go to one place, you come again after 3 months, you go and you come. Well, that is what we call maybe even the longitudinal study. That is still possible. So what are we saying on descriptive study up to this point? I believe something is repeating itself. In a case report, one patient, one case. In a case series, multiple cases. In descriptive study, now instead of multiple disease, multiple cases, now you are studying a group, which we called it a sample. Now you are doing a survey. You see, that is a descriptive study. Also, we have seen an ecological or correlational study where you try to correlate patients having diabetes and body weight. Still, that could be a descriptive study, okay? Or prevalence of, like, for example, we've done a community pharmacy service assessment with one of my students where recently she published a finding on PLOS ONE. So you see, you can compare the pharmacy service in a certain area versus a community pharmacy service in maybe Nairobi versus in Kigali, in Nairobi versus in Addis Ababa. You see, now that is also a cross-section, is a cross-sectional by nature because you are not able to study the whole population. Again, you are comparing. That could also be a correlational study design. So we are on the fourth one. Again, I'll leave the advantages and limitations. Later on, you can see on the slides. And also we can have a trend study where you can study the trend, okay, where you collect data at different point in time and you try to analyze the pattern, okay? For example, maybe an adverse drug reaction, maybe a drug could have a certain area. Maybe you can have an epidemic, okay? How is the epidemic of influenza in different months in your city? That could be, again, that gives you can see the trend. And the same study is also used by people who do business and economics. So at this point, I need to ask each one of you to list in the chat what are the different types of descriptive studies. Let me pause. I know I'm talking a lot, but can you tell me, can you mention 3 or 4 study designs under descriptive? You know, we are talking about observational study. We said observational study design is of 2 types, descriptive and analytical. In descriptive, we are describing the population. We are characterizing the population in terms of people, in terms of time, date, whatever. Excellent. I can see Kennedy has taken the lead saying case report 1. Charlene added case series. Wonderful. Case report, cross-sectional, correlational, trend. Wonderful. That is great. If you are listening, please make sure you can answer. I can see Precious has responded. Wonderful. That is so great. Thank you. I can imagine now we are listening. Any question up to this point? So remember, and again, if you need to use either of these methods, you know, the best thing I advise students always, if you need to do a research, remember one thing, check what has been done before. Maybe one of you can volunteer to write that in the chat. Check what has been done before. You see, you cannot start doing a research from the scratch. Research is done based on how it has been done before. How was it done before? Okay. Thank you. Dumiso. Wonderful. Check what has been done before through a thorough literature review. If you need to do drug discovery, for example, like mine, I do drug discovery research from plants, from animals, from synthetic. Now again, on using computers, the one, if you have heard EMT CADA, that is what we are training people on computational drug discovery. You see, you don't start doing a research out of the blue. The first thing you need to do is you should check what has been done before. What is the best way to answer the research question, okay? It may be using cross-sectional, rather it could be maybe doing a trend study. If you need to see, for example, the trend of reports of ADR from a certain community pharmacy, how is the trend? Maybe you have done an educational intervention. Maybe you have trained thousands of community pharmacies on pharmacovigilance. So you might be interested to assess whether the ADR reporting has improved over months or not. So the best way will be you blend in cross-sectional. Understand the word cross-sectional. Cross-sectional, you cannot eat and finish the whole pineapple at once. That is it. So that you cannot study the whole community pharmacists at once. So what can you do? What you can do is you can study a sample. You can sample a few community pharmacies from a certain region, from different constituencies in your country. Maybe in Nigeria, if you have different constituencies, then from Lagos you pick a certain community pharmacist, and you can see after the training how the report has really improved. So you blend the cross-sectional bit and you apply maybe a trend analysis. So in all this, a descriptive study is describing the population, full stop. If you are in class, I will ask you to loudly say it. Describe the population in terms of age, in terms of religion, in terms of color, in terms of race, in terms of body weight. You are just describing. But this finding I told you is very important. You can put it in a table, in graph. I believe you will have a discussion on data analysis, but that is fundamental. It can help to generate a hypothesis. Okay, wonderful. Yes, thank you, Mosa. I see you are passionate. I love teaching. You should come to my class, or you should, nowadays you can follow on YouTube, and I'm also there, and don't worry. Thank you for that word of encouragement. Good, let's continue. Now, if descriptive study is generating a hypothesis, it's just like this one. You see, I don't need to take it out of context. Again, I need to limit this one in this point. I believe you understand. You are senior students. You see, now you have generated a hypothesis saying that, okay, in a certain community, you studied and you have seen quite a number of peoples who are chewing mirror, who are smoking cigarette, who are drinking alcohol. Okay, the number is good. There you have a significant number. And also from hospitals, there is a report that says, in our hospital in this community, we have a number of psychiatric illnesses. We have a number of people struggling with depression. We have a number of a car accident. This is what a descriptive study tells you. But this study is not telling you it is the smoking that caused the depression. No, it has not told you. There is nothing. It only told you that 20% of the young people in this community, in age maybe 20 to 40, smoke cigarette. Again, in this community, among the different cases of cancer, we have 5% of our cancer patients have lung cancer. It is. So now you are asking a question saying, could the cigarette smoke, could it be the cigarette that is causing the lung cancer? Now you have generated this hypothesis. That is the only thing descriptive study helped you, because it tells you prevalence, it tells you percentage. But it is unable to tell you whether there is a strong correlation between coming late to class and scoring an A or an F. You understand? Whether eating a lot of carb-rich food, and if there is strong correlation with diabetes mellitus. It is unable to tell you whether there is a correlation between smoking and lung cancer. You see the issue. So let's go this discussion to another level, which we call it analytical study design. Now, in analytical study, what we are interested to see is there a correlation. Now we are testing a hypothesis, because descriptive has generated the hypothesis. Now here we need to analyze. What are the two things we need to analyze? You see, in research, there are always two players, like players in football. Manchester, Arsenal, Chelsea, what? You know, I don't know to which fan you are. I cannot say which club I am a fan of, but the issue is there is an independent variable, which we call it the cause, and the dependent variable, which is the result, the effect. Take, for example, the same example. The cigarette smoking could be the cause. That is independent variable. The lung cancer now could be the dependent variable. That is outcome. That is the effect. You see? So now your question is there a strong relationship between these two variables? So one of the modality in analytical study design is what we call a retrospective study. You know, sometimes maybe, this is a human nature. You might say, oh, I saw bad dream, and could that bad dream be since I have not prayed in the evening? You see, you try to correlate. This is human's life, you know. Yesterday, my mom has not called. Could it be since she's mad? You know, you always go back and try to check where things go wrong. When we bring these things in the research space, for example, consider of the earlier case, maybe a group of 10 people can go to a cafeteria. They eat a certain food and they go back home. And maybe from those 10, few of them now might have, diarrhea. Maybe some of them may be vomiting. Some of them may have a headache. The first thing that you will do is maybe, if you are among the group who is sick, you will think, what happened to me? What is the food I ate at lunch? And you will think, oh, that is the cafeteria. You see? Now you'll be interested to see if it could be the food in that cafeteria that is the cause for your current illness. This kind of research that goes backward is what we call a retrospective study or case control. So at the beginning of the study, you will have two groups with the illness and groups with no illness. That are the case and the control. And you go back, maybe sometimes we go back through their medical record, maybe their hospital record, maybe their academic record. You go back and you see how was their performance, how was their diagnosis maybe 5 years ago. So this is what we call a case control, going backward, or a retrospective. Usually case control study, remember, retrospective starts with the problem, starts with the disease. You go to a hospital and you try to look for patients with, for example, asthma. Okay, you can have maybe 5 people with asthmatic symptom, 5 others with no asthma. Now you are interested to know what could be the cause for the asthma. You see, you go back to their medical history. Have they been taking some kind of medicines? Have they been on some penicillin, some allergen products? How was their work condition? Have they been working in an industry with a lot of maybe, asbestos or whatsoever? You go back and you check. Why are you checking? You're trying to check if there is a correlation, if there is a strong association between their current illness and any other past cause. Such kind of study, as I told you, is called what type of study? Retrospective. And we do this, our mothers, our community does such kind of research. And imagine in health setup, this is one fundamental research. It can now help to tell you whether there is a strong correlation or not. That is why when it comes to data analysis, this is what we say, there is a significant difference. There is a strong correlation between the cause and the effect, the disease and the effect. This is called case control. The other thing, I'll come later on the other pieces, is now let's come to see another way. Earlier when we started, we talked about the cigarette story, yes? Take, for example, today, you have a group of 5 people who smoke cigarette today. And again, 5 people who don't smoke cigarette. Just follow them for the next 10 years. Because remember, people say, not like chewing mirror. I don't know if any of you here will be chewing, have ever chewed mirror or will be is chewing mirror right now as we talk. But is there a strong relationship between chewing mirror and having maybe a certain kind of psychiatric illness or a certain kind of cancer? You see, if you need this answer now, you should do experimental study. I will talk shortly. If you are interested to do what? To get the answer. However, you don't know Mira. Mira is Kata idulis, where people usually chew for, to get high. Take, for example, cannabis. I believe, Moises, that is clear. Okay, good. Someone is asking, where is the analytical study? Analytical study is still under observation. If under we are observing. Up to now, we have not given anything to the subject. We have not given anything. We have not said, oh, can you try this one? This one can help you for prevention. We have not done that. What we are doing is we are just observing. Earlier, we saw the group of two groups. One is sick, the other one is fine. You understand? Okay? One came with a certain illness, presenting with an illness. But both of them and the other one fulfills all the characteristics. Remember, the two groups should be now randomized. I'll talk about randomization later on. But you have a case, maybe a group of people with breast cancer and others with no symptom, and you go back into their medical history. Is there any exposure? That is retrospective. Now, the other mode of study, which I'm going to show you, is the prospective. Now, as we start today, now, you have a group of people who smoke weed or marijuana or cannabis. Others do not smoke weed at present. So here we are classifying them based on what? Based on their exposure. Then we follow them now like for 5, 6, 10 years. Whether either of the group, will they develop? Who will develop? Let us say lung cancer. Let us say psychiatric symptoms, depression or psychosis. Which group? You're just following them for years. This kind of research is called a prospective study design. It's just a follow-up. That is why if you've seen quite a number of drug research, some scientists have followed people for 5 years, for 10 years, for 20 years. The follow-up period could be as long as is possible. I have one PhD student now, is finishing. He's been following people who are doing hemodialysis, okay, for like 1 year, 6 months to 1 year. You see, sometimes that is still a prospective. So still you are trying to answer a research question. Remember, when you do research, the goal is to answer a research question. The research question is there a correlation? Is there an association between the cause and the effect? Let me bring it down and as a normal talk. If your fiancé, if your boyfriend or girlfriend is cheating, what will you do? You see, what is the normal thing people do? They try to check their phones, you don't believe it, you triangulate, you see. So you try to follow them for some time. Is this really true? So you're just asking the same thing. Now there's a group who is what? Smoking weed, and other group is not smoking weed. Is there a relationship? Is there a really connection between smoking weed and developing psychiatric symptoms? You see, now you follow them for some time. Interestingly, that you could find the disease in the other group who is not smoking. You see, that is why in research we are so refrained from making rampant conclusion. Our conclusion depends on the basic finding. What is the data telling us? You see, after doing a research course, after listening to my talk today, anywhere you are here, you should be changed. You should have an attitude change. You cannot make conclusion. When someone tells you a rumor, your boyfriend, girlfriend is cheating, you should not believe them. You should say, where is the data? Data should be there. And that data should be triangulated, just like a triangle, at least 3 dots. That is what we are doing in research. So I've talked earlier, retrospective, now prospective is a follow-up. And we do this even for medicines. You see, for medicines, no, clinical trial is experimental. Exactly. Clinical trial, you can put it prospective, but I will explain later on, because when you talk, it can be prospective for sure. Triangulation. Let me explain what triangulation means. Can you draw a triangle? You know, triangle has 3 sides. The term triangulation in research means you cannot make conclusion by one finding. Because you see now, if that is the case, you will make a mistake, because the descriptive study has told you that in this community, there are 50 or 20% of them are men who smoke cigarette. You understand? And there is high unemployment in that community. So if you pick one story, you will be concluding that, oh, it is the cigarette smoking in that community making people to be unemployed. That may not be the case. That may not be the real truth, you see. Or in this community, the under 5 mortality, for example, you'll find under 5 mortality, and you can assess under 5 mortality in a certain community could be like 2%, maybe 2 out of 100 will die. And then you will think that the cause for that under 5 mortality will be assessing, unless you do analytical study, unless you correlate the different variables, you might end up in a wrong conclusion. Maybe the cause for low under 5 mortality could be education, could be finance, could be, you know, quite a number of things. You see, quite a number of things. But if you pick only one variable, just one variable, saying that, oh, it is a literacy status that contributed to under 5 mortality, it may not be the reason. Maybe it could be vaccination. So the idea in the word in triangulation is you need to make conclusion from different results. Lucas, is that clear? Yeah. So triangulation is you don't make conclusion from one finding. That's why in analytical study design, the goal is to correlate findings. Hope I am communicating. Let me know if that is clear up to this point. Have I answered your question? Yes. So prospective is a follow-up. Let's take, for example, you could have patients who are on anti-HIV medicines, you see. And if there is any new side effect with new anti-HIV medicines, for example, now the most countries have introduced PrEP, which is pre-exposure prophylaxis, okay? Is there any side effect associated with PrEP or those people who are using pre-exposure prophylaxis? So you just follow those people at the start from today. You know, today they are not showing any symptom. They are fine, but they are taking the pre-exposure prophylaxis antiretroviral drug. You see, no side effect, nothing. Then you follow them for a few years. So where is your end point? Maybe you follow for 5 years. That is the duration of your study. Maybe you might ask, how do I know the duration of that study? Again, different factors. Maybe you refer to previous studies, you refer to previous findings, and also your budget, because prospective studies are also very expensive. Then maybe it is a 5 years, and at the end of 5 years, again, now you'll call upon all those study subjects and you check whether there is any peculiar side effect or not. So in a nutshell, prospective studies are follow-up, while retrospective studies go back through record. Again, we have advanced prospective studies, which we call them historical prospective studies. For example, consider this case. Let me show you this scenario. You see, now in this case, your question maybe could be, do chemicals used in the tire manufacturing companies, do they really increase risk of death? You see, Now you are so interested to know whether an exposure to some chemicals is strongly linked to mortality, you see. So right now what you will do is, you don't have that report as we talk now, but you have the research question whether exposure to some chemicals could be linked to cancer or could be linked to days. You see, still you are interested to do a cohort, a perspective from day one now. Now you have a group of people working in a certain manufacturing company. Then you have another group. So remember one thing here before I talk far. In all analytical studies, we have two groups. One in the case group, the diseased or the one exposed, and the other one is a neutral group. That is for purpose of comparison. That is why we call it analytical, because you are doing what? You are comparing. Okay, hold on there. Let's come to this research question. You have a certain company. Maybe it is a farm, maybe it's a tire manufacturing company, whatever, but there are workers there, and you are interested to see if chemical exposure could have a correlation with mortality or cancer. Instead of you following these people from day one, from today, you can try to go back in history and to check the record when the exposure started. You understand? Not today. Maybe you can go back from maybe on their employment record, maybe health record. And you can now divide the groups saying, oh, these ones are exposed, these ones are not exposed. Now you follow them. Instead of following them from 2026 to 2031 for 5 years, you go back now maybe to 2020 where they started the work. And then at 2020, now you can now group the employees. The group of these, maybe 10 employees, had exposure to this chemical by 2020. However, these ones by then were not exposed. Now you start to follow them now till 2031. Still, it is a follow-up. Imagine one point here. In a follow-up research, you will be taking measurements periodically. It is not really a one-time thing. You measure periodically, periodic measurement. Maybe if it is blood glucose level, maybe it is lipoprotein profile, maybe if it is cancer markers, you will be monitoring periodically until you get the response. So what am I saying? What I'm saying is a cohort study is a follow-up, and cohort could be of two types. One is a purely prospective. The other one could be historical. You go back a certain years and then you follow for some time. So case control, which is a retrospective we saw, and cohort we saw purely a prospective one. Are we together up to this point? If we are together, can you tell me at this point, let me ask, who can tell me the two types of analytical study design? Maybe from those who are listening live on these reports, let me see. Who can tell me analytical study designs? Yes, you are 51 of you here. Very nice. What are the different analytical study designs? We've talked. We have a prospective and what? Retrospective. Exactly, Maria. Cohort study is usually prospective. It can be retrospective when it is called historical. It is not really retrospective per se, but when you try to go back to 2021 and then you try to say now by 2021, you say 10 group of people are exposed, the other 10 are not exposed, then your time of study will start from 2021 to 2031. So still it is a follow-up. Just you are going backward to start or to define at what point you are going to divide the groups as exposed and non-exposed. I believe I have answered your question, Maria, yeah? Wonderful. So yes, thank you. That is so much great. So what am I saying? So we said Observational study designs are two types. The first domain, descriptive. You describe. The goal is to generate a hypothesis. Now we scaled it up, analytical. What are we doing? We're trying to see if there is a strong association between the cause and the effect. Is there a correlation between smoking and lung cancer? Now you can tell. You see, you have followed these 10 cigarette smokers for 5 years, and you'll ask now which of them have developed symptoms of lung cancer. Then now you can be able to say there is a strong association. Still, you are not saying it is a nicotine that caused the cancer. I'll repeat myself, listen carefully. Analytical study tells you association or correlation. For example, as a teacher, I can follow throughout the semester whether coming to a class has strongly correlated with performance. Then I can monitor students who come early throughout the semester, and I can check their performance. Then I can make a conclusion saying that, students that usually come early to class will have better academic performance. Do you understand? But I have not said it is just coming early to the class is the one that helped them to get a good grade, you see. Here we are not saying it is a nicotine in this cigarette that caused the lung cancer. You see, analytical study, if I show you the slide, is very interesting. At the beginning of the slide, I had explained analytical study tries to test a hypothesis. What type of hypothesis is that one? A correlation hypothesis. Is there a strong association? Is there a strong association between the cause and the effect? See, look, let me show you. You see, the goal of analytical study is to establish a relationship. Is there a strong association? It's not to say this causes that one. No. If you need to strongly see the cause and effect relationship, now you take this research to another level, that is now an experimental research. You see, an experimental research. Let me talk about experimental research. So remember, a descriptive study, we generated a hypothesis. In analytical study, we saw the correlation between different variables. Now, in experimental study, the researcher will try to divide the study subjects into two groups. One is a test group, and the other, or the experimental group, the other one will be a control group. To the test group, and now understand again one thing, still what makes experimental and analytical the same or related is the presence of a control group. You see, unlike descriptive study that says, in this community 10% of them are university graduates. You see, you are just describing. But analytical try to associate 10% of them are university graduate because they have gone to maybe, they tries to give a reason, an association. But in experimental study, you are trying to see if there is a relationship, even beyond a relationship, between the dose and the effect. Yes, you have given 10 milligram per kg of a certain drug to a lab animal. So you're trying to show us, to tell the community, saying that administration of this dose can cure malaria. You see, now there is a component of manipulation. That is why we call experimental study is interventional by itself. You are manipulating your subject. So in interventional study, we have two big types of studies. One we call it randomized trials, randomized clinical control trials, and also we call community intervention trials. So the basic thing in randomization is where now I told you is the treatment allocation. You can have treatment groups, comparison groups. For the treatment groups, now the experimental drug or the experimental compound could be given. This is the same thing we do in clinical trials. Again, you have a comparison group. So be it on animals, be it on humans, experimental studies try to administer something to the subject. It could be a vaccine, it could be a plant extract, it could be a nutrient, a vitamin, but the goal is to see if there is a strong correlation between the dose or the chemical and the physiologic response. Okay, that is why when it comes to like in community intervention trials, you see, or prophylactic trials, which is on immunization, new drug discovery trials, all they use what we call randomization. You see, you divide the subjects to experimental and control groups, and you try to see if there is an effect of your compound on the response. You might have, for example, a drug that could be effective on fungal infection. You see, so now you induce a fungal infection to maybe a rabbit, and then you try to administer the extract to see if for sure this extract or this compound can really help in curing that fungal infection. You see, so it is randomized. The same in clinical trial on humans, we do the same. Allow me to pass the others. I believe you can also read. So the advantage with clinical trials, I know maybe as you move on, you can discuss, is the issue of ethical clearance is very important, because you don't need to subject your study population to any unsafety. That is why not only clinical trial, all your research modalities should pass through a serious ethical review. Let me stop on that before I go to systematic review. Are we clear up to this point? I know it is so broad. If you need me to talk on any of the specific parts, I'm okay to talk on another day. But at this point, let me see if you are all clear about descriptive, analytical, that is observation, and experimental study. Yes, the role of control group in experimental study, you see, still again, it is for purpose of control, because you don't need to make a conclusion. What if, you see, you always ask now, the control groups, what Sania is asking, you see, the control groups might be given a placebo, maybe iron or water, you see, or what, any other inert substance. It helps you to compare that your chemical, beyond reasonable doubt, is it capable to cure the illness. So let's say you have, I told you have minimum how many groups of animals or groups in experimental study. You have a test group and an experimental group. Let's think 2. Usually we have 5 or more. So the test group will take your experimental drug. However, the control group will be given just a water or any other stuff, you see. So you try now to compare the response of the group that took the test drug vis-a-vis the group that took just the inert substance. So that helps you later on when you do ANOVA or post hoc analysis, then to see if there is a significant difference. Is that response by chance, or is it a true finding? You understand? That is a benefit of control. And as I mentioned, it is only on descriptive study we don't use controls. As much as possible, even when you do prospective study, retrospective study, it's a good thing to have a control group. But sometimes it's not easy to get a control group. For example, as I told you, on one of the study we did on patients on hemodialysis, you see, and it was experimental. I'll not talk much on it, but getting a control group means a group of patients who need the hemodialysis but who are not on hemodialysis. Is it really possible to get such a patient? That is impossible. Or you go try to look for patients on breast cancer on a certain medication, and then if you try to have a control group, meaning group of patients who are not on medicine, it will be very difficult to get that group. In that case, we have what we call one arm. Please write it, one arm. It is not two arm. You don't have the case and control. You only work with the groups that is called the case. So you can have one arm prospective study, meaning you don't have the cohort, you don't have the control group. That is in analytical. But however, in experimental study, be it on animals, be it on humans, it is important to have a control group so that you can always compare. The control groups could be healthy subjects. You see, the control groups could be subjects who have the illness but who are not treated with your medicine. You see, you can try to see how their response will be. Not really. Luca is asking, is triangulation the reason why there are many multiple specific objectives in experimental study? And could be, because you see in experimental study now it's a very high level study. You need to also, you see, as I told you, if you start, I like to explain from beginning. In descriptive study, your goal is just to describe in terms of age, in terms of, describe, to say that, oh, Hermias looks this one, you describe, done. In analytical study or experimental study, now you are trying to prove, okay, let's say garlic improves immunity. How? You need to prove, so that you say you have administered garlic extract to lab animals. Good. Then what happens? Then the lab animals' immunity in terms of CD4 markers, T lymphocytes is improved. Good. But again, you need to tell us how. How is that improvement? Does that mean, is it having some anti-inflammatory effect? What is the mechanism of immune booster? Or if you say a certain chemical is immunosuppressant, you see, then how? You might say now, okay, ginger could have or maybe immunosuppressant activity, so it can be a good thing for cancer. That could be your research question. Okay, well and good. You do it on experimental animals, experimental research, but again, you need to justify how. Does it have an action similar like that of steroids? Is it inhibiting what we call the inflammatory pathways? You understand? That is why your experimental research, sometimes you may not be able to get the answer on one side, like in vitro, in vivo. Further, you go to computational using computers to further define the target. I believe, Luca, I have tried to answer that one. And very true, Charlene. You see, that is what we call, again, triangulation. Some of your research questions could be better answered by, not in vitro, in vivo, you mix it. So that all what we talked up to now, as I told you, it is quantitative, done. You see, it is quantitative. I have not talked about the qualitative bit. So why qualitative? You see, qualitative helps us to know the detail. You understand? Okay, in one side, let's talk about adverse drug reaction. Maybe prevalence of nephrotoxicity and hepatotoxicity among patients taking, let's say, some anti-cancer products, you see, or some antibiotics. Is there any complaint of maybe renal impairment or symptoms of abdominal pain? You see, then that the quantitative research will tell you the number of patients who reported abdominal pain after taking a certain medicine. That is quantitative. Be it descriptive, be it retrospective, you can find that one. Okay. But the other bit that you don't know is, you might be interested to have an in-depth understanding on their adherence. So now you can bring in now qualitative. You see, when you talk of qualitative, just you add on your, maybe a simple thing. You can add on your data collection, like focus group discussion. Okay, you can go and add, for example, some key informant survey. You understand? Why do people miss appointment? Maybe they are bored of coming every day to hospital. You see, because they lack hope. Rather, they prefer to go for prayers. You see, that quantitative research will not tell you why they had poor adherence. Maybe they are tired of the hospital queues, but when they go to a herbalist somewhere in the village, they will be served fast. with a good care, with a good acceptance. You understand? This is only you'll get that answer when you blend in, when you have mixed study approach, as Charlene is suggesting here. You see, that is why, and she's really explaining it in the chat box here. How do community pharmacists' perception of barriers? Exactly. What is the impact? Very true. I'm scanning and thank you. I believe you are suggesting some possible topics. So a mixed method research is quite possible. Sometimes you may not be able to answer all the questions. Again, the findings of qualitative research can also help to generate a research that might be answered using an experimental research. Don't forget that one. For example, there is one research which we supported when we were postgraduate students, is the case of Parkinsonism and its association with people who chew drugs like tobacco and mirror. In some community, they found out that among peoples who chew tobacco, who chew kata idulis, some of them, there is an epidemiological report, remember, that says they are struggling with having symptoms of muscle tremors, incoordination. You see now, that was the sparking point for an experimental research to be conducted, whether there is a correlation between chewing tobacco and motor coordination. Does nicotine really affect motor coordination? Does the phytochemicals in mira or chat or in kata idulis, do they really affect motor coordination? And then the student brought that extract, induced it to experimental animals to prove whether that claim is true or false. Hope you are getting the concept. You see, so what am I saying? Mixed method research is quite important. Not only that, even the one I'm going to talk, for example, when you do systematic review, which is another modality of doing research, okay? Now, in all the others, you are, as a primary researcher, you are the one collecting the data. The data is a primary data. You are going to the field, you are going to the community pharmacy, you are going to hospital to collect the data. Sometimes you can also go to published articles and you can now scan data, published data. Now that will be a secondary data. That is not the data you collected. It may be my publication, Esther's publication, Susan's, Lucas, many people's published that finding, or Safia's, many people's publication. Then you try to analyze those publications, you systematically review, okay, and try to get or to provide a reliable conclusion. Why do you need to do that? Because one publication might only talk on the association of salt intake and hypertension. Another publication will talk on the clinical benefits of putting patients on angiotensin converting enzyme inhibitors. Another paper might talk on the benefit of adding statins on patients with hypertension and diabetes. Another publication might talk on the benefits of adding empagliflozin, the SGLT2 inhibitors for diabetic hypertensive patients. You see, those are pieces of information. One variable, one cause, one illness. You see, so when you do systematic review, you can bring in all the findings. You can do a very thorough review following, research is scientific. Write somewhere, please write, research is scientific. You follow a scientific process. Then now you can try to tell the readers on non-pharmacologic management of hypertension, from salt reduction, the role of angiotensin converting enzyme inhibitors, statins, comorbid conditions, hypertension, diabetes, empagliflozin. So you bring it on one paper. Such kind of research is what we can call it in a nutshell, systematic review meta-analysis, and all that. So to do that, I need to share with you 3 important frameworks. The big framework is what we call the PICO. How are you going to search? Okay, this is an approach that will help to formulate a clear, answerable research question that is especially in systematic review and evidence-based practice. So the PICO approach tries to ask, who is the study focused on? You need to say maybe hypertensive patients in adults. Again, you need to look for papers publishing hypertension, ACE inhibitors. Again, papers who have done analytical study where they compared patients on ACE inhibitors and on placebo, and where the outcome, if they measured, is reduction in BP. So you try to scan and pull those papers from the indexes, maybe from PubMed, from Cochrane, from the different database, and then you refine those findings. This is a PICO framework, okay? PICO framework. Then now you can have a good research question saying that, for example, in adults with type 2 diabetes, does metformin improve glycemic control as compared to maybe glyburide? You see, so such kind of questions, instead of you going and doing a fresh data collection of people's on metformin, people's on glibenclamide, and then instead of comparing, you can just do a data analysis sitting on your computer, going to an already published findings on PubMed and others. Then you pull those papers and do a systematic thorough analysis. That is what we call a systematic review. Also, you can add the time on this in this framework. Maybe you can say follow-up. Maybe that was done for 2 years or for 1 year. Or you can also add based on the study design. Okay, maybe you can pick only cohort study designs or case control study designs. So in such a way, you refine. You see, because if you type metformin diabetes on PubMed, you might find like near 200,000 publications, you see. But you don't have that time to screen all 100,000 publications. But when you try to qualify type 2 diabetes and metformin and sulfonylurea, when you use the word "and," these are called the Boolean indicators, or these are easy methods to refine your search. Okay, then that time now the number of publications maybe will come to like a few hundred. Then again, if you need to refine, you can say studies done in Africa. Again, it can narrow down. It's just a filtering approach. So remember, we have these 3 modalities. So you think that you refine your research questions, then it's very important to also to register your systematic review. There is a way, there's a database where you can try to register. Basically, registering really helps for transparency, and also it prevents selective reporting. Okay, then now you do the literature review, you screen, you filter, you do all the quality checks, whether the paper is published in good journal or predatory one, and then now you synthesize the finding. Okay, and usually before you finalize your write-up, you need to use the checklist referred as the Prisma checklist. It really helps you so that you don't miss on important parameters. Okay, important parameters. So this is a bit detailed. I know my time is running, but I believe that will really help. Let me see if everyone is following me. Are we all together? If we are together, can you share the emojis? Where are those emojis? Let me count. Great. Thank you. That is so great. If I'm audible, if you are listening, if you are really learning 1 or 2 things, please like. Can you tell me one framework that is used for systematic analysis? Who can tell me that one framework? The PICO framework example. Good. So there is nothing to cram, because let's say if you type malaria, just try to type or malaria on PubMed, you will find hundreds of thousands of publications. You see, you cannot really review. So you can say malaria and type "and Kenya." Okay, then malaria and maybe quinine and malaria. You see, so malaria, quinine, and then you can say control trials, case studies, you see, and children, so that it starts to narrow down. So you can provide a better systematic review. So generally in systematic review or meta-analysis, you are using what we call secondary data. Finally, as we bring this session to an end, it's very important to talk about referencing. The good thing nowadays, referencing has become much easier with referencing software. But remember, why referencing? I told you research is scientific. You cannot say, oh, I'm you doing this one because Hermes said. No, you should cite my publication correctly. You should not say, oh, this is what I believed. Your belief is not a research. Research is not scientific. You cannot say, oh, I saw so and so in my dream. No, you don't do that in research. Research should be scientific. So if that is scientific, and earlier we have established saying we should check what has been done before. So what is that thing that was done before? Let's see that thing. That thing is found in published articles. And where do we find those resources? Those informations could be found on maybe textbooks. You should start maybe searching on textbooks. Those are called tertiary source of information. For those writing right, the first source of information for research as a review, as an information hub is textbooks. You should start first looking textbooks. The problem with textbooks, they are not usually updated, you know. And science has become so dynamic. This week we have got quite a number of new vaccines that are coming out. Imagine. And soon in my social medias, we are starting now medical news, and hope you will follow later on and you'll be catching up. New updates are coming every minute. So you see, if you base your research only on textbooks, you may not get the good updated information. So you need to go through indexing website. Indexing website could be PubMed, Cochrane database. These ones have well updated case reports, findings, publications. So you need to research on that one, or use Google Scholar. That is also another way you can find published works. Okay, once you got the relevant, and underline the word relevant, there could be a number of publications. You could see a number of things written on Wikipedia, and that is not a citation. Don't cite Wikipedia. Whatever you cite should be peer reviewed. You know, earlier when Esther introduced me, she was saying more than 30 peer reviewed articles. What does that mean? That means peer reviewed means that thing, before it goes published, it is reviewed by quite a number of scholars, scientists from across the globe. And I don't know them, you understand? So it should be peer reviewed. Sometimes we have predatory journals. Journals, you write something and it is just out there in the next day. We are not saying that. So there are some websites again that will help you to check whether a journal is predatory or not. But I believe you will have another day to talk about those publications, journals, and other things. But when it comes to now the quality journals, and if you read something, if you need to adopt that to your paper, you should appropriately refer or cite that article. And two things here in this way. You see, if you don't do an appropriate citation, your paper could be flagged by plagiarism. It will be a copy-paste of someone's work, and that is not academic honesty. That is what we call academic dishonesty. It is wrong. So we have quite a number of citation systems. We have the Vancouver and the Harvard systems or styles, which are heavily used. In Vancouver style, I'll not go to the history behind that, but you can read later on. The Vancouver style is where now you are putting your citations. Remember the in-text and your list of reference, in-text citation using numbers, okay, where you put a bracket and you indicate numbers, like Smith in bracket 10 has argued saying this and that, when your citation is part of the text, okay. Or if it is at the end of the statement, again, of the paragraph, you put numbers. So these numbers align with the list of reference you have at the end of your article. We have another modality of citation that is called, again, when it comes to Vancouver system, when you list your reference list, it goes in numbers 1 to 10. But in Vancouver, in Harvard system or Harvard style, unlike the Vancouver, which goes with page numbers or the author's number as per the list on reference list, the Harvard style uses the name of the author and the year of publication. You see, earlier we said Smith in bracket 10 argued that, reading this and that, or salt reduction, or insulin helps for type 1 diabetes. You see, so in bracket you have indicated the number. That number aligns with the list of authors, the list of references in the reference list. However, in Harvard system, instead of numbers, now you say, for example, Carson, 1970, argued. That means now this one uses the name of the author and the year of publication. This as per the APA style. APA, or American Psychological Association, usually they share or update the standard, the APA 6, APA 7's style standard. You need to refer to that one. But the easy way for you is now either to use the referencing software. The easy way is using the referencing software like Mendeley or Zotero, which makes everything easy. If you need help on that one, maybe we can plan another day, or I'll try to connect you to another speaker from our university library, which can guide you on how you can use those softwares. But it's very easy. Just Google, download Mendeley, and you can watch a 1 or 2 minute video on YouTube, and it makes your work much easier. But when you publish, you need to follow the standard modality of citation. Sometimes you can see if the authors are 2, you need to connect them with the symbol and not the written full end, okay? And you need to do your citation consistently. Maybe sometimes the author name, comma, 1970. If you use that one, you should use consistently. If not, still allowed without putting comma, you can still write the whole as it is. Okay, when you have more than one authors, you can again use what we call ether, which should be in italics. Okay, so these all rules are when you use this referencing in text citation. Again, when it comes to list of reference, again, there are quite many rules. Whether you got that article from a book, from an article, from a conference proceeding, that again has quite a number of rules. I know I may not have time to go through it, but for purpose of the exercise I shared, I think I only display this rule, that is when you use an article in a journal. You see, the title of the journal should be italicized. Okay, it should not be abbreviated, number 1. The volume number should be in bold. Okay, you should put the part number usually in bracket, and you should indicate the first and the last number. And please take a snapshot of this one. So if you are using an article in a journal, you should write first the author's surname followed by the initials. For example, if it is my article Tarafa, then E.M., you see, then the title of the article, okay, maybe anti-diabetic effect of rosemary. The name of the journal should be italicized, and comes the year, the volume, in bracket, the number, then the page numbers. Okay, so I've shared an exercise. I believe you can be able to attempt that in such a way. Check, for example, this one, Lauria DB, that is the surname and initials, the article title, okay? Then the name of the journal in italics, the year, and it goes. Or else it's also possible to bring the year. Hallelujah, please mute. Okay. Thank you. So we use it in such a form. So it needs a bit of practice, and also, as I told you, the use of a referencing software. At this point, I think I'm on time. I was told from 5 to 7. Now we are like 5 minutes to 7. But if you have any question on research methods, so what we talked in all this session to do summaries, we've been talking on research methods. Yes, we talked that research needs a primary or a secondary data. You know, research relies on collecting data. So when you use a secondary data, meaning a published finding, then you can do a systematic review. Systematic review helps to make a quick clinical decision making, okay? To define what is the best dose of, for example, ciprofloxacin in UTI in pregnant mothers, or ciprofloxacin in UTI in men. You see, what is the best dose? You could find different articles who talked about the use of Cipro, the use of other antibiotics in UTI. You try to generate some evidence. So that systematic reviews, meta-analysis can really help in really informing practitioners. That is secondary data. If you use primary data, you can do a research which could be either observational, which could be a descriptive or analytical, and also even experimental data, experimental research, where you need to really to see the correlation between different variables. And remember, in all this, it's very important to do an appropriate citation. So thank you very much. Yes, it's okay. Yeah, I'll share that one. And someone is asking for my social media handle. I'm typing it. Before you go, type this one, DRERMIAS. You can just go, not that one. Let me write it again. Sorry for that mistake. Is there a way you edit? Yes. MT. If you do that, that will take you to my YouTube channel. I know you really love it. Hope today at the end of this session, my YouTube subscribers will increase by 50. That is a good thing. Yeah, I love teaching, and also I do quite a lot of mentorship. If you have any issues, feel free to reach, and I'm always ready to support. Maybe in the meantime, as I try to put the link that will directly take you to my channel there. If you have any question, please feel free to just ask. Yes. Again, if you are doing your research, let me know. You can be guided. And one thing, let me say this one. You see, always when we teach in class, I'm a teacher, and when students see our publications, my drug discovery, it's quite fascinating, and you'll be so pushed to do the same, to do a research or to publish. But let me challenge you. This world, this time, this era, especially our continent, needs innovators. Not only researchers that do nice research and put it in publication, put it in shelf, there you can see a lot of articles. I challenge you. Open your mind. There is a lot of opportunity where you can innovate, where you can discover. If you are a pharmacy student, you have a great up in hand to come up with a herbal product. Majority of our African population, this week we are celebrating the Black African Month. The Black African Month is not only about, colonial, not those stories. but it's about solving the African problem. Maybe I know this is an international pharmacy students federation. You may be students from all over the world, wherever you are. And I'm telling this one to my fellows. You see, just open your mind. You need to be innovators. You can discover herbal products. They are quite huge opportunity to come up with herbal products. It could be herbal supplement, drugs from herbal medicines. You know, not only herbals, could be synthetic from seeds, from oils, synthetics. But this is a time where you should be encouraged to come into the space of innovation, number one, discovery, number two, commercialization. That is where most of your lecturers, including myself, we lacked. We discovered the drugs, we discovered potential things, but that has not translated. And these days, especially this year, I've been preaching a lot about this. You need to have that open mind to challenge yourself. What is the innovation? What can I do to my country? You see, not only graduating and looking for a job opportunity, you can come up with a herbal product. If you have an idea, I'm here to help you. I can help you. I can guide you. It's not since I have all the answers, but we can sit. We can call upon like-minded people. We can look for support. If it is funding, now funding is much possible for innovation. Innovation, then product is important. The product could be a website, could be an application that can support people's health problems. You see, now most of you are also smart people, so you can come up with a technological product that is possible. You see, then commercialize that one, bring it to the market. That way you'll be proud of yourself. You don't achieve anything much, but the big thing you can do is you'll be proud of yourself because you have at least some product in the market. You have contributed. Thank you very much. God bless you. I'll be here to listen into any question, but I've been following and I've not seen question. Please feel free to unmute. But up to now, if you have enjoyed, I believe you have subscribed to my YouTube channel. Let me just go to my YouTube. Hope you have managed that. Yes. Let me see how many of you have gone to the YouTube. Let me see in show of hands. So I'll send you some giveaway gifts wherever you are. Maybe Esther and Susan can collect the list. Yes. For those who are raising their hand, I'll send the PowerPoint directly to their email. Usually I don't send the PowerPoint slides, but yes, if you had subscribed to that, wonderful. Oh, this is a good team. You should invite me so often, and I'm happy to join. Yes, hope this year we'll meet in Rwanda. Yes, the conference is in Rwanda. Yeah. Hope I'll see you in Kigali. Is that in Kigali? Yeah. Okay, wonderful. Thank you. Back to you. Yeah, great. Back to you, Esther.
Thank you so much, sir. You can see the participants, they are very happy.
Very happy. Yeah, I can see. Yeah.
Yes. So, thank you so much for a wonderful session. And thank you for accepting our invite. We are very happy. And I have just one question.
Please, yeah.
You normally ask me in class, now it's my turn.
Yeah.
Okay. So, at the end of this training, we expect participants to prepare either the abstract or maybe doing the innovative project. So, what could be the main takeaway from this session that will guide the participants to do either of them what I have said? Yeah, either abstract or the project.
Yeah, thank you for that question, Esther. You always ask a very, very matured question. You are one of the best students I ever had. So this is the point. If you are doing your research, maybe for sure, I believe if you are planning to come for the conference and to compete, maybe to do oral or poster presentation, for sure you should be doing some kind of research. So by now, maybe you've started writing maybe a proposal or whatsoever. So the point is, if that is the case, make sure your research question aligns well with the method. Remember, a research method is born from the research question. The research method is born to answer the research question. Just remember that. So let it align very well, because I'm also a reviewer for more than 20 different international journals. And the first thing you will check when you see a paper, when reviewers see us, I'm telling you now on the eyes of reviewers, you see, the first thing reviewers will see is the research question sound? Number one. Number two, is the research question aligned with the methodology, or is the methodology answering the research question? Number three, what about the data collection, the tools you used? Are the tools you are using, are they aligned to the method? For example, your research question method says you use mixed method, both qualitative and quantitative. Well and good. Then when it goes to the data collection, if you have only a questionnaire that will help to check the quantitative variables, and there is nothing on collecting information or data on qualitative aspect, like if you don't use unstructured interview, if there is no what we call key informant survey, or if no focus group discussion, then it means something is lacking on your data collection. You understand? So the home take message is, let your research question align with your research method and data collection. That is very important. And the best answer you can get is check what has been done before. What has been done before? If you are doing an assessment of contraceptive use in a certain area, okay, then first check, how do other researchers assess use of contraceptives? You see, you should first check. If you are interested to assess anti-malaria efficacy of a certain plant extract in lab animals, first you should check related publications on that aspect. Esther, hope I've tried to answer that one. Maybe you can ask, yeah? Esther, is that clear?
Yes, sir, it is clear. Thank you so much.
Great, okay.
Is there anyone who has a question before we end our session? So, as some participant asking the questions, this is our secret word for attendance and the Google form for the question. So, before we end, is there anyone who have a question? You are free to unmute and ask.
Okay, people are asking to send the link. Maybe if you have a WhatsApp group, I don't know if any. Esther, please copy and share that one, but I've tried to copy paste, and I can see people are coming to the channel. But if you have clicked the link, it will take you direct to the YouTube channel. You can comment, and just subscribe, and then you can see the videos. And if you use the same username on LinkedIn, you can see me on LinkedIn, and feel free to reach out. I'll share my number if any of you need support. I'm very open. Feel free. I have a booking calendar. You can also see the link for that booking link is found on my TikTok. If you go to, I'm also on TikTok. I don't know if I've mentioned that one. The same link, the same thing. You can use it on TikTok. On TikTok link, you can see a link. Then if you follow that, you can see a booking website which can give you a date and time when I'm free. Then for sure you can book. appointment, then I can be able to provide you any help. Thank you very much for your time. May God bless you all. See you another time. Esther, I can see no question. Now you can take over. Hello, colleagues online. Thank you. Hope you have enjoyed the live session. Thank you for being with me on YouTube and also on TikTok. I really appreciate. This was a live session. Those of you on TikTok, if you need really to get the materials and anything, feel free to check on YouTube, because it will be uploaded on YouTube with the PowerPoint. And make sure you check the link on the bio.
So if you need more connection, I've shared the website and social media where you can find him. So please kindly do so. So now we have shared the chat for the attendance. Is there anyone who cannot see the link? Please kindly let me know.
Am I allowed to leave, Esther? If I think
Yes,
you
sir.
are.
Thank you so much.
Thank you. Okay.
Thank
Okay.
you so much.
God bless you, everyone. See you soon. Bye.
Bye-bye.
So thank you, colleagues on TikTok and on YouTube. I've really enjoyed sharing my session with you all. It was really great. Maybe you can share some like buttons today on this live session. I've been teaching on research method, a group of near to more than 50 young health professionals on research method, on how best they can do research. So that is what I shared. So all the PowerPoint, the recording will be uploaded on YouTube. So make sure you follow. If you need a one-to-one support in teaching and research, feel free to reach out. This is a time where we can collaborate, support, and also make sure you like my channels. If you have enjoyed the session, let me see if you can put some like buttons. And thank you for being with me in today's session. And I wish you a lovely evening and a nice weekend ahead of you. Thank you. Any comment? Maybe if you have been with me, maybe you can say hi. You can say hi, Emias. Maybe let me see. Let me see if any of you have been watching, and if you had really enjoyed the live session, let me see some like buttons. And in the comment, you can tell me from where you are joining. Are you from Nairobi? Hi, Grace. How are you doing? Thank you for joining this live session. Hi, Vera. This is a long live session. We've been here now for like more than like near to 2 hours. It was amazing. It was amazing, and I've really enjoyed. It was a vibrant discussion, and hope Grace and others, hope you have enjoyed that one. Let me know if you have any comment where to improve. Hi, Sel Atara. Thank you for being here, and great. See you all in another session. I will have number of live sessions, and I'll be interacting. Let's keep engaged. Let's interact. You know where to reach me. The link in my bio has everything. And see you and wish you a very good evening.